Respiratory physiology, obstructive versus restrictive disorders, and how to understand these. You're watching A to Z Medics. Don't forget to like, share, and subscribe. So, obstructive physiology, what's happening is that there is a blockage in the airway. Given that there's a blockage in the airway, there is therefore an inability to actually expel the air. Now, let's say, for example, your forced vital capacity, the FVC. Remember, the FVC is the air that we breathe in. Assume, or let's just go with 100 units. This is arbitrary units. It doesn't matter what units I'm using here. Let's just say it's 100. So you breathe 100 in. You then look at the forced expiratory volume in 1 second, i.e. the air that we breathe out in 1 second, FEV1. Let's say that this is only 40 units that you breathe out. So you took in 100 units, but you are only breathing out 40 units. That means when we do the calculation, we will get 40 over 100, which is equal to 0.4. Why? Because we were able to breathe the air in, the lungs were able to take it up, and when we breathe out, however, there is an obstruction in the actual airways, the trachea, bronchioles, and so on and so forth. And due to the blockage in that region, the air that we breathe out is compromised. It is only, in this example, 40 units. So I get an FEV1 FVC ratio of 0.4. And so the reason this is because the lungs themselves are able to expand fully, but due to a blockage in the actual airways, not all of the air that was taken in is actually able to leave. Now let's take a look at the restrictive picture. Now, restrictive issues or restrictive respiratory physiology is based on the fact that the lung parenchyma, the lungs themselves, may undergo some form of restriction, be it due to scarring and or otherwise. And therefore, if my lung parenchyma, which remember is somewhat elastic, what we refer to as compliance, so elasticity of the lung parenchyma is what we call compliance, the stretchability, the elasticity, the recoil. If you've got scarring to all of the lung parenchyma, then you are unable to actually inhale in the first place. And so therefore, if I'm unable to take a breath in that's going to fully expand the lungs because of this scarring, the forced vital capacity, the air breathed in, may equal to somewhere around 45 units. As again, arbitrary units, and this is purely an example. The air breathed in is limited, it's only 45 units. But because I've no restriction in the actual airways, the airways are clear. The trachea, the bronchioles, the bronchi, they're all clear. So all the air that I breathe in, I am actually able to breathe out. So I'm able to breathe out all 45 units. And as such, my FEV1 to FVC ratio is 45 out of 45, which is 100%, which is equal to 1.0. So the ratio is 1.0. So remember, with the restrictive disorders, the lungs themselves are actually unable to fully expand due to a reduced compliance for whatever reason, whatever pathology. However, all of the air that is taken in is actually able, and therefore we obtain an FEV1 FVC ratio of 1.0. Now, it shouldn't come as a surprise that everything has to be standardized. So when it comes to the ratio, we use the standard of 0.8. Obstructive pathology leads to a ratio that is less than 0.8, whereas restrictive pathology leads to a ratio that is greater than 0.8. So this is less than 80% or greater than 80%. And again, you go back over the lecture if you need to understand how we got to that maths. So to summarize, remember, obstructive picture, you've got a blockage in the airway, therefore an inability to actually expel the air, whereas a restrictive picture, You've got compromise of the lung parenchyma and therefore the lung compliance, whether that's due to scarring or other reason, and therefore you have an inability to actually inhale and fully expand the lungs. So obstruction, air is unable to leave. O for obstruction, O for out. With restriction, there is an inability to enter in the first place. Thank you for watching. I hope that was helpful. Don't forget to like, share, and subscribe, and watch out for some more videos.